Good afternoon. Thanks, Nadia. So it's great to be presenting here today. As Nadia said, my name's Natalie Portwine. I'm presenting with my colleague Marcella Carvajal, and we work at the Dementia Research Unit. So next slide, please. The Dementia Research Unit is part of Sussex Partnership NHS Trust. We're based in Crowborough, but deliver research across East and West Sussex. We work closely with our clinical colleagues to promote research and to offer people with dementia and their carers the opportunity to take part in a range of research. Next slide, please. We work closely with the Centre for Dementia Studies. This is a joint venture between Sussex Partnership NHS Trust and Brighton and Sussex Medical School, working in collaboration with academic and health organisations, and with the NIHR Applied Research Collaboration and the Clinical Research Network in Kent, Surrey and Sussex. Next slide, please. At the Dementia Research Unit, we deliver a range of research studies. This includes clinical trials and drug studies. So the drug studies are usually multi-centre, international, randomised, placebo-controlled trials. Participants will receive either the investigational medicinal product or a placebo. The participant and the dementia research team do not know which they are receiving. The investigational medicinal product may be a new or novel drug, or repurposing of drugs licensed for other diagnoses. For example, we're currently delivering a study exploring a drug licensed for diabetes. Eligibility screening for drug studies is very thorough, ensuring that participants meet the strict criteria set by the sponsor. And drug studies require that the participant and their carer or study partner are able to attend the Dementia Research Unit for assessments and safety checks over the 2 to 3 years of a study. So the commitment to drug studies is a big commitment for people with dementia and the carers. Next slide, please. Oh, sorry, we've done it already. So intervention studies. So these involve a therapy or an intervention being delivered. For example, we currently have a study delivering an intervention for people with dementia experiencing sleep disturbance. Participants are randomly allocated to either intervention or control or treatment as usual. Some members of the research team are blinded, so they do not know whether the person is receiving the intervention or the control, and this is in order to carry out assessments and outcome measures. These studies are delivered in participants' own homes at the Dementia Research Unit, or since COVID-19, we've been able to deliver some studies over a video call. Observational studies. These follow participants receiving usual clinical care. So, for example, attending a memory assessment. Typically, they involve completion of assessments and questionnaires to gather information about people's experience. An example is the study presented by Rebecca earlier, which is looking at the experience of people with memory problems who attend memory assessment but end up with no dementia diagnosis. These studies can be delivered face-to-face or via video call, or it may be by completion of an online or paper questionnaire. Next slide, please. Research participants tell us they value taking part in research, hoping they may benefit themselves, but also by contributing to the development of new treatments and interventions for others. They value regular contact with health professionals and being able to seek clarification or information about their health condition. The dementia research team support people to take part, but participation is always voluntary and people can withdraw at any time. I'll hand over to Marcella now, who's going to talk more about how we deliver research studies.
Thanks, Natalie. So a day in the life of dementia research. We have a dedicated research unit in Crowborough. Dr. Tabit is our lead. We have office space, we have clinical rooms where we do clinical assessments for our studies, such as ECGs, blood tests, and that kind of thing. We also have a lab where we process blood samples and prepare them for analysis. And we have a big comfortable lounge for our research participants where they can sit and relax during a day at the unit. Who works at the research unit? Clinical research nurses, research coordinators, and research assistants are part of the team. And we are supported by a team leader and an administrator. And of course, we have our principal and chief investigators leading on this research, such as Professor Tabet and Dr. Gosha Ratchek. What do we do as research coordinators? We are responsible for the delivery of research studies and clinical trials. This includes the recruitment to studies by liaising with clinicians, service users, and promoting our research in the trust, and also implementing these study protocols. Every study is very different and has a very specific process and schedule of visits. So also every team member performs different tasks on every study. So such as recruitment, assessing capacity, and taking informed consent, performing physical health checks, cognitive assessments and questionnaires, and taking blood samples and processing them, and also dispensing and delivering study medication as well as data collection. So it's a lot to do on any given day. So we have to coordinate all of this and be very organized and detail orientated, and of course be clinically confident and competent in performing these tasks. Of course, it doesn't end there. After each patient visit, the work continues. We must make sure that everything is well documented. All clinical notes and data that are collected during study visits must be attributable, legible, and accurate, and stored correctly. We have protocols and regulations to comply with, such as information governance, confidentiality rules and regulations, etc. We liaise with study monitors, including data monitors and medical monitors, to answer any queries and follow any safety procedures as part of the study. We liaise with central labs regarding blood test results, making sure that our patients are doing well and are being looked after by us. And of course, regular checks of all the equipment that we use, refrigerators, freezers, blood samples, the equipment that we use to process blood samples, ECG machines, and all that stuff. And at the end of the day, it's not all about the protocol. We are very patient focused. We're advocates for our research participants. We like to make sure our patients feel welcome and they feel valued and safe with us. We like to build relationships with all our research participants and like to get to know them and what is important to them, what makes them feel more comfortable, likes, dislikes, just make sure every visit is a nice day for them as well. And we address any questions or concerns and offer support before, during, and after every visit. How do we recruit people to research? We use advertising and promoting, such as posters, leaflets, newspaper adverts, liaise with clinicians in the trust for referrals to studies. We have databases, internal one and a national database, Joint Dementia Research, which some of you may be familiar with. And a quick summary of our current studies. We have a study called Evoke. This is a 3-year study looking at the effect and safety of a daily tablet called semaglutide. This is already being used to help control type 2 diabetes. So the study is looking to repurposing that drug and examine its effects on cognition in people with early AD. We also have a study called Dream Start. This is a dementia-related manual for sleep strategies for relatives. So this is a non-drug study that aims to improve sleep difficulties experienced by people with dementia living at home. And we also have CUMIN. This is an MRI study for the memory clinics in the trust. It's a study looking to test whether advanced analysis of MRI brain scans can help with the diagnosis and prognosis of people with memory and thinking problem. So this project will address the development of quantitative neuroimaging techniques, including AI techniques, using MRI imaging applied to clinical practice. So those are the three main studies that we're currently recruiting to in our unit. And if anyone has any questions or about the studies or about how we work, and also, of course, to send any referrals that people are maybe interested in taking part in our research, that's our team email, Dementia Research Unit @sussexpartnership.nhs.uk. And that's it. I don't know if anyone has any questions or like to say anything to us, but I'm more than happy to take any questions quickly.